continuation of the left coronary artery is called the circumflex artery. After giving off the anterior interventricular branch, this artery runs to the left in the left anterior coronary sulcus. After doing so, it winds around the left border of the heart, left border of the heart, and continues in the left posterior coronary sulcus. Near the posterior interventricular groove, it terminates by anastomosing with the right coronary artery. Branches of the left coronary artery. The anterior interventricular artery is a large branch descending in the anterior interventricular groove over here. This is the anterior interventricular artery. It gives the following branches: the anterior interventricular branches for the ventricles. The left large branch is called the left diagonal artery. This is the left diagonal artery, where the septal branches, which are supplying the anterior two-thirds of the interventricular septum. Then we have a left conus artery forming an arterial ring around the pulmonary trunk, with a similar branch from the right coronary artery, as you can see here. This is the left conal artery over here. Right, you can see this is the anterior interventricular artery, this is the diagonal artery, this is the left conal artery. Anterior interventricular artery, diagonal artery, left conal artery. The circumflex branch is the terminal part of the left coronary artery. After it has given off the large anterior interventricular branch, the circumflex branch runs in the left anterior coronary sulcus, then curves around the left border of the heart to lie in the left posterior coronary sulcus. Here, it's the left posterior coronary sulcus over here, and it ends by anastomosing the terminal part of the right coronary artery a little to the left of the crux of the heart. This is the crux of the heart. The branches: left marginal artery. This is the left marginal artery, which is lying along the left border of the heart till the apex of the heart. Anterior and posterior ventricular branches, atrial branches, are in anterior, posterior, and the lateral groups. Here, this is the right coronary artery with the branches. It is giving off a sinoatrial nodal branch in 40% cases. It is giving a conus arteriosal branch. Atrial branches are anterior, posterior, and lateral. It is also giving off the right ventricular branch, the acute marginal artery, also the posterior descending artery, atrioventricular artery, and the right posterolateral artery, whereas the left coronary artery is giving the conus arteriosal branch like the right one, forming a ring, the left circumflex artery, which gives rise to the left marginal artery. The left coronary artery is continuing down as the left anterior descending artery, and the diagonal artery. Right? So this is the diaphragmatic surfaces. So you can see that this is the circumflex artery over here, this is the right coronary artery over here, and this is the posterior interventricular branch. Areas of distribution. Number one is the left atrium. As you can see, this is the left atrium. Anterior part of the interventricular septum, a part of the left branch of the AV bundle. Ventricles: greater part of the left ventricle except the area adjoining the posterior interventricular groove. Small part of the right ventricle, small part adjoining the anterior interventricular groove. Here, cardiac dominance. In about 10% of hearts, the right coronary artery is small and not able to give the posterior interventricular branch. In these cases, the circumflex artery, that is the continuation of the left coronary, provides the posterior interventricular branch as well as to the AV node. In such cases, the heart is called left dominant. Mostly, the right coronary gives the posterior interventricular artery. Such hearts are right dominant. Thus, the artery giving the posterior interventricular branch is the dominant artery. Now, collateral circulation and cardiac anastomosis. The two coronary arteries anastomose with each other in the myocardium. We also have an extra cardiac anastomosis. The coronary arteries anastomose with the following: vasa vasorum of the aorta, vasa vasorum of the pulmonary artery, internal thoracic arteries, bronchial arteries, the pericardiophrenic arteries. And the last three anastomose through the pericardium. These channels may open up in emergency when both the coronary arteries are obstructed. Retrograde flow of blood in the veins may irrigate the myocardium, but these anastomoses are of very little practical value. They are not being able to provide an alternate source of blood in case of blockade of a branch of the coronary artery, and blockade of arteries, or usually the coronary thrombosis, leads to death of the myocardium, and this condition is called the myocardial infarction. Now, thrombosis of any coronary artery is a common cause of sudden death in persons past middle age. This is due to myocardial ischemia, infarction, and ventricular fibrillation. Incomplete obstruction, usually due to spasm of the coronary arteries, causes angina pectoris, which is associated with agonizing pain in the precordial region and down the medial side of the left arm and forearm. Now, this procedure, called the coronary angiography, determines the site of narrowing or occlusion of the coronary arteries or their branches. Angioplasty helps in removal of this blockade. It is basically done by using a small stent with an inflated balloon through a catheter passed upwards to the femoral artery, aorta, and into the coronary arteries. Now, if there are large segments or multiple sites of blockade, a coronary bypass is done using either the great saphenous vein, you can see this is a venous graft, or an internal thoracic vein. This is a graft from the internal thoracic vein, right? So you can see it is connecting from the aorta directly over here, bypassing this blockade route. Okay.